We all need our routine checkups, whether we walk upright or on all fours. And as Eddie Pet owner will tell you, pet meds can get a little pricey. So in today's Find a Friend segment, sponsored by Rascal Animal Hospital, we have head veterinarian Dr. Michelle Gonzalez here with some deals to help save you money. So Dr. G, before we get to all the great deals, God, we've got two cuties. So talk about who you have first.
So this is JD. And then that is Daisy, and these guys are litter mates. They're about 3 months old. They're retriever mixes, and they were rescued by Pet Promise, which is a local foster-based organization. They rescued them from a kill shelter that was overcrowded. So they gave these guys a second chance. They've already been fixed. They have their vaccines, microchips, and they're looking for a great home.
And they're what, 11, 12 weeks?
They're about 12 weeks old, yeah. Okay. And they are puppies. They are retrievers. They're very rambunctious. They like to get into everything. So, you know, they need to be adopted by people that are prepared to deal with a puppy like that, but they are, as you can see, very lovable too.
Oh, they are so lovable. I love it. Okay, well, something that most shelters do when they adopt out animals is make sure, like you said, they have their first round of vaccinations and meds, and after that, it's up to the pet owner. So what are some of the most common things they need to do once they adopt a dog?
So the biggest thing is having that initial checkup. Even if they've already been examined by the shelter veterinarian, it's super important that they take them to the veterinarian so that they can start a relationship and to make sure that there's not something that has been missed. And not every shelter has the opportunity to provide full veterinary care to all the animals. So very important to get that done. Things like intestinal parasite protection. We want to protect them, but we also want to protect ourselves and our kids because there are parasites that can be contagious to people. We want to make sure about fleas and ticks are another important thing. And then with dogs, we get pretty concerned about heartworm disease.
And heartworm's one thing that we've talked about before. That's definitely an important thing. Daisy's trying to just, you know, see what's up over there. Come here, girl. So heartworm prevention, can heartworm be fatal to dogs? Can that be something that really makes them sick?
Yeah, definitely. And heartworms are transmitted by mosquitoes. One thing that we hear a lot as veterinarians is, my dog doesn't need heartworm protection because it's inside all the time. Well, there are two things with that. First, mosquitoes can come inside of the house. And second, most dogs go outside for either a walk, they go outside to use the bathroom, and any of those times, mosquitoes can attack them. And right now this summer, mosquitoes have been really bad. So that is how they're going to get them. Once they are infected by these mosquitoes, by the heartworms travel to their lung vessels and to their heart vessels, and then they can cause congestive heart failure.
So how often do they need to be looking to get the heartworm medicine?
So most heartworm medications are labeled for once a month. They come in the form of pills, and then there are also some topical medications that can be applied. And it's a monthly thing, and then once a year they get tested to make sure that they're not heartworm positive because nothing's 100%. And we want to make sure that these guys are as safe as possible.
Okay, so after they get their heartworm meds, are there other meds that they should consider as well?
The flea and tick medication is the other big thing. Same thing. People will say, my dogs don't go outside, so they don't need flea and tick medications. Well, the fleas do not know the boundaries of the front door. So they can come inside, they can hitch a ride on our shoes when we're walking out in the grass. The fleas can jump on our shoes and then come inside of the house, and they're their preferred host. So as soon as they come in the house, the fleas will jump off them and get on the dogs.
So how bad has it been this year? Because we're in tick and flea season.
It has been horrible, and one of the things that we have noticed as years go by is that even during the winter time, we still see a lot of patients that are crawling with fleas. So it's important to maintain them on these medications year round.
And what kind of problems can those cause? Obviously itching, we see that kind of thing, but what else are we looking for?
We always get concerned about just that they look dirty, they look disgusting, and that they're itching, but they can transmit a lot of parasites and some really serious ones like Lyme disease.
Okay, so all these things dangerous, but the good thing is you guys have a promotion going on right now. So you want to tell people about that.
Yeah, our great friends with Vectra, Interceptor, and Trifexis have given us the opportunity to offer to people to get either a year of Trifexis, and then they're given a $50 rebate for that whole year, or getting a year of Interceptor with a $12 rebate and 6 months of Vectra, which is the flea and tick topical, with buy 6 get 3 free, and then they are paying for a free heartworm test. So one of the things that we hear at times is, you know, it's so expensive and the heartworm test is expensive and everything's expensive. They're taking away the cost of that heartworm test and then giving amazing rebates on all these medications to make it more affordable for people to get it. And we're going to be running that from August through October at the hospital and then also at the Rascal Unit vaccine clinics.
Perfect. All right. Rascal Animal Hospital is where all that is. We can get these guys at Pet Promise. So thank you for being with us, Dr.
Thanks a lot, Robin.